we're pre-op procedure number 2, and why don't you tell us a little bit of what led you here in the first place?
Sure. You know, starting with probably since I was going into business school in my late 20s, started first experiencing some, you know, male pattern hair loss, mainly around the crown and the back, and it really took me probably, you know, close to about 10 years before I considered doing something. You know, I was one of those, probably in between type of candidates where, you know, there was a gradual progression and then actually a little bit more serious of hair loss, but not to the point where I really considered something until probably my late 30s, roughly. From there, I went around to quite a few number of doctors in different institutions, just really trying to do due diligence the best I could, and really understand what would be the best procedure for me. And you know, I'm somebody who takes a lot of time and does a lot of work in advance. I went to a number of different private places in Beverly Hills, a larger, more well-advertised hair procedure place, and just got as much information as possible about the procedure, how it was done differently, by the different doctors. And from there, it led me through a very strong referral. It led to Dr. Dower, and then again, after really shopping around and looking at a number of different places, I really felt that I felt most comfortable here with Dr. Dower. I felt that he certainly took the most time and was more specific and personal, to at least my needs. And that's what was brought me here just about a year ago. And from then, basically coming into it, I guess like anybody, have certain apprehensions and a little bit nervous about the process and what's going to happen. As it was explained to me by Dr. Dower, it was what the procedure was actually, was basically over the course of, do it 6 hours thereabouts. And even after the fact, that it was, relatively painless and not, it didn't put you out of commission for a great deal of time. All those were true, which I was, really pleased by. So, going into it, it was, basically a day of your time, a little bit less, some minor discomfort, but on the whole, pretty painless and done very, very thoroughly and quickly. And then on the post-operative portion of it, with a little bit of medication and other things to help you through, but on the whole was really, really painless, as described by Dr. Dower. So from there, basically about a year, I think the first 2 or 3 months, like anybody, you want to see things happen immediately and whatnot, but I think there's a period of adjustment and having the procedure kind of gain some ground and progress. But within, I'd call it, 4 to maybe 6 months on the late end, there was significant and noticeable benefits and difference in around the crown and even towards the front of the crown, which was kind of where I experienced the most hair loss. So, again, pretty painless post-op procedure, and within 4 to 6 months, there was noticeable differences for the positive with the procedure. And hence, I'm back here, not even a year to date, 11 months on a follow-up, and assured that it will only benefit going forward.
How does your hair differ now from what it was like 10 months, 11 months ago, pre-operatively?
The major differences are the things that you probably don't think about so much and are almost brought to your attention. And two things that over the course of the last year, it's amazing how many folks, my friends, family, close relatives, and people who know me, you get a similar reaction, or I have, where people will come to me and have said, "Wow, God, you think so? You look a hell of a lot healthier or younger, or things look better. And without really nobody had known that I'd done the procedure, or quite frankly, although I think I know that they were talking about my hair, that wasn't. It was kind of indirectly is how people recognize you and see things different about you. So I can tell you, a number of people, friends, family, people I'm with closely on a day-to-day basis came to me and said, my God, you look good, you look really a lot younger, better, a number of different things. And either specifically they would address my hair, looking better, or just in general. And I think a lot of that is attributed to the procedure, but it really has, a real profound impact. And then secondly, even smaller stuff, like I told Dr. Dower, I had some pictures from about 10, 11 years ago when I was getting my graduate degree in my MBA, and just looking at some of my pictures back then to now, and just even me personally, just being struck on what a difference there is between now and what was over a decade ago. My hair looks considerably better this now than it did then, which is pretty amazing.